Hi, I'm Judith Gilligan. I work for the Cochise County Health Department, and I'm here today with Chuck Alton from KCTR News and a half a dozen of our community partners who helped the Cochise County Health Department put together our community health assessment and community health improvement plan. So we're going to talk a little bit about what those things are, why we're all here, and how you can help. The community health assessment and community health improvement plan process is something that the health department engages the community to find out what are the biggest health issues in our community and what is it that we as a community can do about them. This effort of completing a community-wide health assessment and a plan to address the issues in that assessment involved many partners. And I have only a few of them here with me today, but I want to thank all the folks out there who see health in their community as a primary issue. It was interesting for some folks to find that the economy was one of the priorities that came up in the health assessment, because health is more than just where you go to the doctor or just what disease you have or whether or not you're sick. Health is about what your daily life is like. Do you have fresh air and clean water and safe streets and a good job? There are many different factors that go into people being healthy on a daily basis. So we collected, we encouraged, recruited many partners in the community to help us complete the assessment and then put together this plan and continue to work with us on making some advances in health in Cochise County. Some of those folks are here today, and I'd like them to tell you a little bit about their perspective, why they are participating in the community health assessment and community health improvement plan from their personal perspective or the perspective of the organization that they represent, and how the community-wide plan is going to help folks all throughout Cochise County to become healthier. And finally, we're going to talk about how you can be involved, because again, it's a community-wide community engagement process, and we can't really improve the health of Cochise County without your help.
Hi, my name is Tom Reardon. I'm with the Cochise County Reentry Coalition, and I'm currently serving as a volunteer on the Good Jobs and Healthy Economy Priority Area Working Group with the Cochise County Department of Health and Social Services. One of the things that really impressed me about this entire effort is that the role of the department in this project. It's shown to me, and I think it's shown to my fellow volunteers that in private sector agencies that local government can be involved in things involving the public welfare, the public good, and especially involving public health. The health department has stood up to be a leader and a driver of this effort. And then in the military terms, since we're near Fort Huachuca, what I've seen so far is what the military calls consolidation on the objective. That means you bring disparate resources together at the same place at the same time to execute a mission. And that mission, our objective that we consolidated on, was the CHIP, the County Health Improvement Plan. It took, again, a wide range of talent, a wide range of expertise and experience and motivation, I might add, to make sure our economy is impacted favorably by an excellent environment for health. And I think that's what this will be in the end result once the CHIP is out and people have had a chance to digest it. You're going to see, I think, an improvement in not only health, but the political environment, and I think in the regulatory environment, and I think it will aid and impact favorably on our economic development objectives, because we'll be able to sell in the very near future that to people who are trying to seek a new market, that we definitely here in Cochise County take good health seriously. It stacks up right along with our great weather and wonderful climate. So I am very pleased and proud to be part of this effort, and I look forward to keeping this thing sustained and moving for years to come.
Hi everybody, my name is Becky Smith and I'm with the Legacy Foundation of Southeast Arizona. And the Legacy Foundation was really quite privileged to be involved in the community health assessment and in the community health improvement plan for a number of reasons. One, because the collaboration between the groups that were involved was so amazing. I have to say, countywide, the participation from different organizations and different people around the county was just phenomenal. And we were told as we went through the process that the community health assessment done for Cochise County was one of the best that has been done in the state of Arizona. So the information that we have gathered from our communities is really good information, and it's good because we went out into the community. We went out to Winchester Heights, north of Wilcox. We went out to Wilcox and Douglas and Benson and Bowie and Tombstone, and really all of the communities within Cochise County, so that your voice would be heard about what do you think are the issues are with regard to health in Cochise County. And from all of that community outreach, we came up with the 3 goals, as Judy was explaining to you earlier. But now, again, that we have the 3 goals, and I'll reiterate what Candace has said to you, we need to continue your voice in the process of making an impact on the health in Cochise County. We want your voice to be heard. We don't want to feel like it's just coming from the health department or organizations around the county. We're trying to impact everybody in a very positive and sustainable way on all 3 of those goals. So we would ask that you find your voice, you reach out and be a part of this, because it's important that you are. The Legacy Foundation, additionally, I mean, one of the questions that comes up often is, okay, so how are we going to pay for this stuff? How are we going to do this stuff and be able to afford any of it? The Legacy Foundation is a community foundation, and we provide grant funding for nonprofit organizations around the county. We're benefited by that because it helps us connect the dots between all of the different organizations around the county that do similar services and identify synergies. And so being part of the Community Health Improvement Plan allows us, and actually our board has made the decision that our strategic grant funding for this year will be dedicated to the Community Health Improvement Plan processes. Those funds are allocated to the Community Health Improvement Plan. So if you have a voice and you want to share it and you want to be a part of this, there are organizations and people who want you to be involved and want to be involved with you as we move forward with this. So please be heard. Reach out to the Community Health Health and Social Services Department. Judy will give you that information here at the end, and it's also at the bottom of your screen. You can see that. Reach out to us. One other thing, we do have a speakers bureau, so if you want somebody from one of the volunteers around the table here or others to come and speak to your organization or speak to a group that you belong to, we are more than happy to do that. So reach out to us again, and we'll share information with whoever needs to hear it from your perspective. So thank you.
Hi, I'm Jacob Jones Martinez, and I'm the Healthy Communities Coordinator for Cochise County Health Department. And part of, I guess, most of my job involves going around the county and establishing and maintaining citizen-led committees throughout the county in each community so that people can get involved and address the health needs of their own community. Where the Community Health Improvement Plan sort of where the rubber hits the road is with these communities. And when we're talking about getting people involved, the healthy community committees are designed to address the needs of the community. We need participation from people in each community. So we have committees in Sierra Vista, Benson, Wilcox, Tombstone, Bisbee, and there is an existing group in Douglas, and we're working on developing a larger one there. But these committees are designed for people to get involved and address change or change what they feel their health needs are. We're talking about all of the social determinants of health, so things like transportation, creating a quality of life or improving the quality of lives. Because I live outside of Sierra Vista, and I don't know what the people of Benson need, and I don't know what the people of Wilcox need. We create committees in those communities so that the people of Wilcox can decide what improvements need to be made. And ideally, these committees can create partnerships and collaborations to work together with cities and organizations in those communities to create that change, whether it's policy change, changing a system, or changing the environment. The idea is to get citizens involved, to get people involved, to work together and create that change. And so what we hope will happen is you will come to these meetings. Most of them meet monthly. Wilcox meets every other month. And then you can engage in that participation. I know that there's a lot of feeling of not being able to make some of these changes. And the idea is for these committees to make that change, to work with city governments or organizations to make sure your voice is heard, and then influence the policies or whatever it is that needs to be addressed to improve the health of those communities.
My name's Duff Chambers. I'm the chairman of the Healthy Tombstone Committee. And so I want to tell you how our committee started and what it's doing today. I went to a meeting in Sierra Vista a little over a year ago, and when I walked in the door and said I was from Tombstone, they said, "Oh, Tombstone? We never get anyone from there." So I took that as a challenge and left the meeting to go back and create a committee serving our community. We recruited about a dozen people to serve on the committee. We have representation from the Marshal's Office, the Fire Department, the Food Bank, the Senior Center, American Legion, and even the Masons. And we meet on a monthly basis. We try and identify some of the shortcomings in our community and develop ways that we can confront those issues and try and move in a positive direction. We've been able to accomplish an awful lot since the beginning of our committee, and it is only through the active participation of the members of the committee that these things have occurred. We currently have a list of about a dozen objectives that we'd like to accomplish in the next 2 or 3 months, and we are trying to collaborate with not only with the agencies in our town, but the agencies in the county. The health department is a tremendous support to us in our efforts, and the support of the city council, the mayor, and the community has made us as successful as we are. We meet every second Tuesday at 3 p.m. in the Senior Center, and our meetings are open to the public, to any member of the public, as are the meetings in the other towns that Jake mentioned. Any plan has to be fluid, and this plan that we have developed for the county is a fluid plan. It can only be changed as we identify and plan for new objectives, new goals. I work with the Mental Health and Substance Abuse Subcommittee, and those issues are paramount in Cochise County. The services just are not available, and so we're working very hard to see if we can't do something to improve those services. We can do a little bit, but unless everyone's involved, unless everyone is aiming toward the same goal, we are not going to be successful. So we need your help. You need to get active in your community now.
Hello, I'm Candace Weingart Selleck of the Community Food Bank of Southern Arizona. I was very honored to be asked to join the committee to work on our Cochise Health and Improvement Plan. And I want to just give you a little history. The Community Food Bank of Southern Arizona has been involved in food security for over 40 years. We work extensively in the Cochise County area, and we are extremely concerned about food insecurity in Cochise. Everyone eats, right? And we all need to be aware of how our health and wellness is impacted by the food that's available in our community. One of the 3 priority areas is, of course, healthy eating, diabetes, and obesity. And one of the great focuses of the Community Food Bank is ensuring that good, nutritious food is available. As we talk about this initiative, we're very concerned that there are grocery stores, there's access to food, and also the economic issue is highly important because with poverty, people aren't able to access good, healthy food. And that's been a focus of the food bank now for quite a few years. So working together with my esteemed colleagues on this program, we talk often about how to improve the health. And as mentioned earlier, health is not just the availability of your primary care physician. Health is also the neighborhoods we live in, the safety. It's walking parks. It's the ability to feel safe enough to, take your children out and have a nice afternoon. So when we think about health and wellness, we combine our issues with mental health and substance abuse, our economic development, and good, healthy nutrition. But I guess the point that I would like to make is that we're all involved in this. It isn't just a group of people, our wonderful group involved in the steering committee, our funders, it's everyone. And that means that you as an individual, you as a group have a real opportunity here to drive the direction. It's not just that we have developed this plan, it's the plan for the community. And so there are many numbers, and I know that Judith will come back on at the end, and she will support the opportunity for you as individuals and groups to contact us, but we would like to invite you. We would really like you to participate in this plan. And we'd also like to hear your ideas, because although we have a completed CHIP, Cochise Health Improvement Plan, we are also open to how we're going to actually implement this plan. Cochise is a wonderful place. We all live here because we dearly love our climate, our environment, but another real specialty of this area we live in is that we have an amazing number of dedicated leaders in all facets of our neighborhoods and areas, but we're always looking for more. We're always looking for more groups and people who really want to make a difference and make Cochise the place to live. So thank you.
I'd like to echo my esteemed collaboration partners once again in inviting the entire community to become involved in helping make Cochise County a healthier place to live. Whether you join a local committee in your local city or neighborhood, or you choose to participate in one of the priority area work groups, mental health and substance abuse, jobs in the economy, healthy eating, or you choose to volunteer in some other way through as a member of a community action group that already exists in your community. In any of those ways that you want to join, we encourage you to participate because it takes everybody's participation to make our county healthier. And we talked a lot about the assessment and the plan and the committees and the work groups and the priority areas. Over the last year and a half, we have also hosted 2 community health conferences to help the community understand, well, what is community health? How is it any different than individual health? I thought health was about going to the doctor or going to the hospital. Health is about way more than that. And so there are a whole variety of ways that we can help you and that you can help us to make the community healthier. And all of those things we refer to as the Healthy Cochise Initiative. It's an initiative to help our communities become healthier. We call it Healthy Cochise. And there are a variety of ways that you can get in touch and find out how you can be involved with all the things that we talked about, the committees, the work groups, the priority areas, the community action groups, the annual Healthy Communities Conference. We have a website, www.healthycochise.org. We also have an email address, healthycochise@cochise.az.gov. If you'd like to read the Community Health Assessment and the Community Health Improvement Plan, those reports are available on the healthycochise.org website. It's on the Cochise County homepage at the bottom under Quick Links, and it says 2017 CHA Chip. Give us a call or an email anytime. Thank you.